I'm Dr. Sarah Peterson, OBGYN and founder of Vera Health and Fertility, where we provide a holistic, personalized approach to patient care. One thing I wanted to talk about today is, how do you know if you have endometriosis? So one thing that's important to know about that is that there's no way to diagnose endometriosis unless you have surgery, which I know seems like a lot, but I consider endometriosis almost like freckles or moles on your body. If you have an ultrasound, if you have an MRI, if you have a CT scan, there's no ultrasound that's going to show if you have moles or freckles. You just have to look at it. Endometriosis is similar in that there's not a lot of imaging modalities that can definitively determine if you have endometriosis. You just have to go in with the camera and look at it with your eyes, which makes it a bit difficult. Some of the symptoms of endometriosis, the biggest one is pain during your cycles, but about 1 to 7% of people who have it are asymptomatic. We don't exactly know where endometriosis comes from. It could be immune dysregulation, cell dysregulation, or genetics. It's probably a combination of a lot of different things. And what endometriosis is the lining of the uterus, called the endometrium, instead of being inside the uterus like it's supposed to, can cause implants in other areas, most commonly the ovaries, the uterus, the fallopian tubes, things like that. But the big deal about endometriosis is that, number one, it can cause a lot of pain, so painful cycles. Number two, it can really affect your fertility. And number three, it can cause issues in pregnancy, such as increased risk of C-section, preterm birth, issues with your placenta. So if you're having painful cycles, then you should definitely get checked out. Some studies have shown that up to 70% of women with painful cycles end up having endometriosis, and up to 50% of women with infertility have endometriosis. So it's important to get it checked out, see a doctor, and get it completely removed and excised to help with your painful periods, help with your fertility, and help with your overall general health, because decreasing all of the inflammation that endometriosis causes will also make you feel better in the long run. If you have any questions, give us a call or look us up on the web, verafertility.com.